Hi there, it's Steve from Northeast Functional Health. The little topic that we're going to be talking about today is how muscles effectively just do what they're told. Now, in clinic, we use a form of muscle testing. It's imperfect, lots of people will slate it. However, if used objectively, it's a really useful tool to kind of give you a window into what the nervous system is doing and how your system responds to different stimulus. So, in clinic, muscles can test in one of three different ways. Normal, which is what we want, so something tests strong, it's easy for you to do, there's no pain, and it switches off to a given stimulus. It's really important that muscle can switch off, because if it can't switch off, then at some point it will just start giving you discomfort, or it will just give up the ghost and go weak. Now, we then have things in clinic which test strong, it's easy for you to do, there's no pain, but for some reason it doesn't switch off. Now, there are a couple of techniques which we can use to ascertain whether a muscle can switch off or not. And if they can't switch off, that is due to a stress response. That response is put in place by your brain because it perceives it needs that thing permanently on to hold in place something else. It's using it to hold you up effectively. It's scared that if it allows that muscle to switch off, something bad's going to happen. So just imagine that you're going to fall over or something like that. We then have things in clinic which for some reason just don't engage or test weak. Now, there's always a lot of talk about whether the verbiage you should use, whether you should use strong and weak and whatever. Now, we're not talking strong as in strong in the gym, I can pick up a big weight. We're not talking weak as in I can't pick that up. It's just the vernacular we use for, yes, that muscle is engaging the way that it should be. No, that muscle is not engaging the way that it should be. And then we're all about trying to promote a normal response. Now, if you effectively go around and let's just say interview what's that muscle doing, what's that muscle doing, what's that muscle doing around an area that someone has pain, it kind of gives you a picture for, you know what, for some reason that's not engaging, for some reason that muscle's locked down as a stress response, and start looking for why is the brain telling those muscles to do those things that it is doing, or rather sometimes isn't doing. So if you're having treatment where someone is just treating muscles, let's say you're trying to strengthen something, and don't get me wrong, I'm a massive fan of strength. Strength, simply put, allows you to compensate better. It gives you greater capacity to cope with the funk that's in your system. Great, you might hurt less. However, it doesn't give you a long-term resolution to the problem. If someone is just releasing a muscle, maybe they're doing a bit of trigger point stuff with you, maybe they're getting you to stretch. We'll have a video on that as well. Some things won't stretch, some things won't strengthen, and that is because the brain perceives its needs to do what it is doing. So it is making that muscle weak for a reason, it is making that muscle locked down for a reason. Now, unless you go looking for what that reason is, those muscles will just continue to do the same thing, irrespective of whether you release them, whether you stretch them, or whatever. And this is why problems come back. So let's say you go for a massage and you feel great for a couple of weeks, and you need to go for another one, and you need to go for another one, and then you need to go for another one. Great business for a massage therapist, right? However, in terms of the client or the patient, they are not getting the best treatment available because, remember, as I said to you, what the muscle is doing is just an output of what the brain perceives it needs to do best to cope with whatever is going on. So if you're just feeling like you're having treatment which is just kind of masking or just kind of treating symptoms or just kind of making you better for a week or two here or there, then maybe go and see someone who doesn't just do muscular work or doesn't just adjust something, because again, similarly, joints will lock down for a reason. So if someone kind of says, oh yeah, that joint's locked, I need to adjust that to get it moving, from my point of view, that is not looking at the whole picture. If you assess why a joint is locked down, you kind of say, right, why is that not moving? There's going to be a reason for it. It's doing what it's told. A really, really common compensation will be for someone to compress a joint when they haven't got stability there, which will lead to increased joint wear and will lead to a potential lack of range of motion at that joint. If you just force it to move, the brain's going to go, nah, I put that there for a reason, I'm going to put it back. And so next time you go and see that person, they'll just adjust it again, or they'll just release the same thing again. That is treating symptoms. If you want to find out why those things are behaving the way that they do, then get in contact with us.